Welcome to this, our DPI GINA program, where we look at the water sector. Today with us we have Managing Director of the Guyana Water Incorporated, Dr. Richard Van West Charles, who will be telling us about some of the development that has been happening for the past 6 months. Thank you for your time.
Thank you very much.
What are some of the achievements for the first half of this year, accomplishments in terms of having access to and quality of service, and how many communities are now connected and having access to potable water?
Sunika, thank you for your time. In terms of access, I think we have to look at it first in terms of what are the programs we have in GWI. We have a program which speaks to the water production and then water distribution, the supply. Both are linked with the issue of water quality. And then there is a program which speaks to the organization and management side, and sanitation and finance. Specifically with respect to water production, one has to go region by region. In the hinterland regions, there are a number of wells which are being, in the first 6 months, one at Oronok, which has been drilled, but a number of contracts have been awarded at Kamwata. Then in the area of Mabaruma, Region 1, we've established a new reservoir, and we are moving water from the Hosarora Falls with a new pump station there. That should be completed really by the end of August, and that would impact significantly on the supply in the Mabaruma area. We've also just signed an agreement with the NDC in Matthews Ridge to refurbish 2 springs and to add another spring. The importance of this is that increases the supply, but we are also seeking to ensure that the water is of a good quality for citizens. In regions 7, 8, and 9, there are a number of initiatives also with respect to one. In Region 9, we are drilling a number of wells, which in collaboration with the regional administration and the Brazilian military. So we remember last year the issues with respect to the impact of climate change in Region 9, and it's one of the regions we are looking at as a priority. So as a result of that, we even established an office in Region 9. In Region 7, we are drilling a well in the Essequibo and Tasserine. In Bartica, a contract is awarded for drilling a well at 4 Mile in Bartica. I think Bartica is one of those areas in Region 7 which has only been getting water from the surface water. But what we're doing presently, we are exploring a number of groundwater supplies, right? And so we are drilling a well at 4 Mile in Region 7, in Bartica particularly. It's a challenge because you're confronting rocks, but even yesterday I had a discussion with the contractor, and they're having a new rig to actually drill through the rocks, so that we'll have that well, I hope, within another 5 to 6 weeks. Region 8, I think before I finish Region 7, in Paramakatoy, we're putting a new reservoir. There was a system there which was not efficient. So we're working with the regional council. We're actually going to capture water from the mountains, and we're now preparing a new reservoir there to be able to gravity feed to the population. Well, I think what is important though is not singularly the supply, but there is a heavy emphasis on the quality of water. we want to work to support the Ministry of Health's actions in terms of its reduction in waterborne diseases. We are also looking at a number of these hinterland communities, the villages and so forth, to ensure that they have filter systems. You know, even at the time of these floods which are occurring, we've put in a number of what we call lifesaver jerry cans, and we have so far installed 4 large C2 filters which serves the community. We've put over 100 already to a number of these communities, and in particular regions 7 and 8 have benefited from them. The larger C2 filters, but for the community, we've been able to put at Camarang Hospital, for example, which was getting water from the Camarang River, but not treated. Based on our own water quality analysis, the filter is working successfully, so the hospital is getting filtered water. At the Baracara School, there is a filter there also, and in the school in Kako. So these are initiatives geared for these populations. As the President indicated, there should be no inequity between these populations in the hinterland regions and the coastal regions. So this is our drive, our effort to ensure where these are going. When it comes to the coastal regions, we've been improving the network distribution significantly. In regions 4 in particular along the coast, we very soon will complete laying a number of transmission lines. We're bringing a number of communities who haven't had water, and you may be surprised, even in Georgetown. And so just beyond Guy Hawk and so forth, there are some communities which really don't have access, and we have established a contract whereby those communities will be getting. You would have seen in Region 6, in Jacksonville, Molson Creek, and we are seeking to work. We don't know all of the communities which do not have access, but as we discover, as the ministers go out and they discover, they feed us with information and we respond. But we feel that the regional democratic councils can help us significantly in identifying where these populations are. In region, on the east bank, which is part of Region 4, we've increased the supply of water to Silver Hill, Guayacabra. We've run extension lines in Yarracabra, Kurukuru, Hillfoot, and so we have a number of other communities to visit. We have communities to visit in the next few weeks coming: Bamia, Adventure. Well, Hairuni was one, but we've just signed an agreement with the Basic Needs Trust to do a well there, and the Swan community on the highway. So we're looking at these communities to seek to ensure how we can address their needs. I mean, we can't address all the needs in this year, but we are trying to work with them, and whatever assistance we can do, we can give, we seek to ensure, because water quality is important. For example, in Soesdijk, we discovered about 200 households that were not connected, and we are moving right now to connect them, run the pipelines so that they can be connected to the water system. Linden, we are looking at improved access. There's a project with the Rotary at Old England. and we're looking at a number of other communities. We did Andyville late in December last year, but we're looking at a number of other communities. Linden has, although a lot of money was spent in Linden under the IDB project, there are a number of issues which we're addressing right now. We have had to invest probably more than $160 million just to correct some of the faults of the project, the IDB project, which I met. So we are intensifying this area, and I said water quality is important. Now, one of the things that we have pushed for is looking at moving from 8, 10, 12-hour distribution to 24-hour distribution of water quality. In Georgetown itself, you know, the water at Shelter Belt was coming out without any controls in terms of its water quality. I think it is safe to say now that the system has improved significantly. We've put in new pumps. We've put in a public health laboratory which monitors the water every hour, 24/7. So water quality, as I said, is front and center of what we do.
You mentioned having access, communities for the first time having access to water. What is the situation in Limasand and Kairuni? I understand that there were plans to put a water system in Kairuni and Limasand.
Limasand's a well is there, a new well. We understand that some of the residents have opined that they do not need access to water from the well, but our people are going around to each household to be very clear whether they want water from us as a customer. Because we know that this matter could be a political issue. And so we want to be assured by the residents. They have an option whether to become a customer with us or not. But we want to be assured that these residents really do not want to become a customer with GWI. And we're very sensitive to, especially some of the communities along the highway, that those communities were neglected for a very long time. And so we have a special eye on those communities.
Okay, back to Hinterland, you mentioned Husororo. I know there's a falls there, so will you be capitalizing on that falls? How would this system work?
Well, we've worked with GEA on this matter. We had to replace a reservoir, and that reservoir was constructed here in Georgetown, and it was assembled in Mabruma. We worked with GEA in terms of, because GEA is going to use the falls also for energy. So we collaborated and they worked with us. So we are going to move some water from the falls into the reservoir and then gravity feed into the community. And we're putting chlorination systems also at Mabruma. That, my information indicates, will be completed by the end of August.
Okay, how many persons are we targeting in terms of household getting access?
It's the entire community around Mabruma, including the hospital. Yeah. And we do know, though, that we have to do some additional drilling of wells in the area.
Staff development seems to be one of the key focus of GWI. At a recent event, in fact, you said, you quoted saying that over $60 million was spent towards staff development under your management. Could you expound on this some more?
If you have a company, you have to invest in staff. An entity such as GWI requires certain competencies. So we've got to be assured that we have those competencies for us to be efficient and effective, both at the technical level, in terms of the engineering, at the laboratory level, at the customer service level, at the finance level. So we have conducted, even at the IT level also, a series of gap analyses, which has pointed to some of the gaps with respect to competencies. And a number of staff were trained. Customer service is a priority. We're trying to do a paradigm shift with respect to staff and understanding that the customer is the center of our universe, and therefore we have to respond and treat customers in a way that is expected. We're trying to change the culture. For example, if we have to change a meter, the customers should be informed ahead of time. They should be written to, have a discussion with them, explain to them and why this is happening. We want to change the culture in, if we have made errors, we should be able to apologize to our customers. So I haven't got, that is where we invested quite a lot of money in customer service. On the engineering side, yes, we've sent a team, 2 teams, one last year and one this year, consisting of 5 engineers to Oklahoma. GWI doesn't have any installed drilling capability at this juncture. My recollection when I had Gaiwa then as a minister in the 80s, GWI had installed drilling capability. So we are moving, based on all the recommendations of the auditors and so forth, we are moving right now to develop, ensure that we have the competencies for drilling. I would say generally the drilling culture in Guyana is not of the best. And hence, on this round, we sent our staff and we also opened the door to a number of contractors to go to Oklahoma. I think it was a good experience, and we will do it again because we need to be on the cutting edge. So it is for this reason that we awarded a contract to the Dutch company who is here already. We signed the agreement early this year. The Dutch company is here now. Their rigs have arrived, and they'll be drilling wells for Diamond, Sophia, and Sparendam. And the difference is they're using a different approach, but also I can have the wells in six weeks. The track record of wells in Guyana has been much longer. But I think everyone understands that we have to deliver at a faster rate. The other approach which we made with respect to drilling of wells, if you looked across the coastal regions or any of the communities, we've tended to have a singular well in each community. Now, that is not one of the best approaches for sustainability and water security within a population. So we are going on a different approach of having well fields and having the system connected so that it helps to protect the aquifers, but it also gives security. So if a well fails, then there are other wells that can serve the area. So those are some of the things with respect to the drilling. We have, we hope with the IDB funded project, IDB EU funded project, for 3 water treatment plants, one at Ifluk, one in Diamond, and one in Shitanko. But we are refurbishing the filtration, aeration, and disinfection processes in a number of our treatment plants as we speak. And all of these activities are directly linked to our focus on water quality for WHO standards. We have tended, I think, to drill in what we call A sand wells. When you drill for water, you drill in A and B sand. The B sand is much deeper. It has less iron. So when we've been drilling quite a lot in the A sand wells, hence the high iron content of the water. But we've been able, with the guidance of our technical staff, to introduce a new chemical which prevents the oxidation of the iron and hence prevents the redness appearing in the water. So right now, the entire Essequibo coast, for example, we have introduced it to the Essequibo coast, Good Fortune, Agricola, Ithaca, Edinburgh and Berbice, Clonbrook, Bachelor's Adventure, Festival City. And so we're moving to address all of these communities where you've got the high iron content. Because we know it is not fair to the customer to have their bathroom tiles soiled. They are unable to wash their clothing, white clothing, you know, so we are very sensitive to this matter. And therefore we are seeking to address it. One of the issues, though, is that as we seek to improve the service, we want to encourage the customers to pay on a timely basis. I think this year we've done, compared with the first 5 months of this year to last year, we've collected probably 17.2% higher than in our collections than last year. But we've got a good way to go in terms of getting that money in. So we're working and we're hoping that with the bill delivery system that we're going on a monthly basis. We've just completed zoning the country. We know we have a few delinquent bill deliverers and we have zero tolerance for them. So we just found a few and we dismissed them because people need their bills on time. Only last week somebody said to me, "Man, you're very efficient. You deliver 3 bills at one time." That's not efficiency, that's inefficiency because the bill deliverers are delinquent. So we are seeking to do that, and because we've zoned the country now, we've got contractors assigned to each zone and bill deliverers and meter readers. But within another 2 weeks, we are going to be launching 2 apps. One, we have to, in order for us to have better pressure in the system, we have to control the leaks in the system. So we're seeking to get the population involved in working with us. So if you've got a cell phone, you will have an app on your cell phone in which you can take a picture of the leak and send it to us, and which would allow us to respond at a faster rate. Likewise, if you're a metered customer and we are moving to meter the entire country, by the end of this year, we hope to add another 40,000 meters to our customer base. And we hope within another 2 years, we will complete, after 2017, by 2018, 2019, end of 2019, we will complete the country in terms of its metering. That helps us to do 2 things. We've looked at the analysis. It reduces, it controls water usage. Once you're a metered customer, you control how you use the water. But more so, and you pay for what you use. So I think that helps us in terms of the recovery of revenue at a faster rate, and it helps us with the losses, the non-revenue losses in the system. So I think that will help us to improve the efficiency and the effectiveness and the service to our customers.
Okay, I know you briefly mentioned it, but let's talk more about the challenges you guys would have had over the past 6 months.
Well, basically, I think one of the challenges is the procurement process. I think we would like to see a faster procurement process. You know, this is a utility that has not just commenced. We have been in existence for over 50, 60 years. So I think in this instance, the engineers would say to you, look, we know certain types of pumps work well. So there are issues besides the specs, there are durability factors and so forth. So those pumps work well. I think the procurement process, however, somehow precludes the purchase of a brand. And I think GWI has had a bad experience in simply going with generic specs and purchasing pumps. Anybody bids, and you purchase pumps, people bid in accordance with the specs. But what is on paper is not what you get when the product arrives. And so GWI has had a bad experience in that way. So on the procurement process, we need a faster procurement process because we have, for example, right now, a number of awards to be made which are impacting negatively on two things. On our level of disbursement of government of Guyana funds, and secondly, the expectation of the population to have the access to water as quickly as possible. So I think that has been a challenge for us. The other challenge is energy. You know, we can't do much without electricity. Our main supplier, they work with us well, but they have their own challenges which affects our systems. In certain areas, there are greater challenges than others. In Region 3, for example, we have some serious issues with voltage fluctuation, which damages our pumps. So we've got to look different methods. And so we are considering looking at alternative sources of energy for pumps that may be driven by solar energy and so forth. So those are some of the challenges. On the IT side, we've had significant challenges this year. I think we are in a better place now. You know, we were hacked for a while. In February, we were down for quite a few number of weeks because of the poor security systems that were in place. Part of it is some degree of negligence on the part of some of the staff. But I think we are in a much better place now. We've had a few assessments done, recommendations. We had some people in who worked with us to secure the system, and so we are in a much better place. But we have a number of other things to do, and we have to change our billing system. We have a very old billing system, a system that creates a high degree of dependency on the providers. So if I have to change a tariff, we cannot change a tariff here in Georgetown. It's a company that is in the UK, I have to go to them, I have to pay them. So those are significant issues, and we are moving now, our staff right now, they're evaluating a number of billing systems so that we can have one that gives us more control in terms of adjustments that we make with the work processes, the tariffs, and so forth. So that is a priority for us, and hope that we can at least make a decision before the year is out on the new system, and then that takes some time to implement. So I think always the competencies of our staff, you know, in terms of you asked about the training, for example, we've trained a number of people from 14 communities in the hinterland regions to maintain the photovoltaic systems, for example. So we trained about 28 people from different communities. We have another 36 communities to train to maintain the photovoltaic system. We've invested in a number of engineers. 2 at the moment are in Delft University in Holland. Another one is going next month. And we are, a number of others are doing some online programs with the said university in terms of improvement in the distribution systems. We've been in discussion of purchasing some suite of other courses to strengthen other levels of staff, working with the Caribbean Water and Wastewater Association and CAWASA. So I don't think we can not afford to invest in training our staff. It has to be a priority. Then the other thing which we are doing, we started a research project for the first time, really looking at it's a customer health and customer survey. It's being done in a very rigorous manner. We're getting the support of a professor from the University of Ohio, and our staff, our engineers, the data processing staff, the staff from the strategic planning and evaluation and monitoring unit. We're really moving to do this sample across the country. It's going to give us a lot of information with respect to the perceptions of our customers and how they see us, and help us to look at some areas which we probably are not aware of to improve the system. So that is going to be significant in terms of the area of water production, how we manage, and so forth.
As we come to a close, in a nutshell, could you tell us, in terms of moving forward, what are some of the planned programs, and what can the Guyanese population look forward to in terms of improved service delivery from GWI?
Well, my wish really is to get the water production to a level that, and water quality, that you will be able to drink water from the taps. So water quality is a critical issue for me and for us all. I would really like us to remove from our landscape the black tanks. And the water quality, the pressure, controlling the leaks are part of that process to try to ensure, to give the customer the confidence. We are going to share the water quality results with the population via our website. You can look forward that from the website you'll be able to check your accounts. On your phones you should be able to get your balances. So we're going to a different level now, but the important thing is gaining the confidence in the product that we have. So we want to ensure, we want to have a quality assurance with respect to water quality, that you will see the results not only from our laboratory, we will have some reference laboratories so that the Guyanese people. The other thing is, I would like to ensure that all our schools have water of a high quality, that our young children can drink and have water at schools, whether you're here or in the hinterland. And also the health facilities as a priority should have water in accordance with WHO standards. So that's where we're heading.
Thank you, Dr. Charles. We have come to the end of this, our DPI GINA program, where we spoke to Dr. Richard Van West Charles, Managing Director of the Guyana Water Incorporated. Thank you for your time.